Period pain is a pain in your abdomen that might spread to your back or thighs, and usually it starts in the beginning of your periods, or sometimes it might start several days before it, and in average it lasts not longer than until third day of your menstruation. Intensity of this pain could be different. Some people may experience mild cramps and others could experience severe pain, and they have to call emergency because the pain is so strong. And there are so many people experience menstrual pain, but not many of them talk to their healthcare provider about it. I will definitely recommend you to discuss this problem with your doctor, because menstrual pain could be caused by other health conditions. Primary dysmenorrhea is caused by the excess of prostaglandins in your body, and prostaglandins is a substance which makes your uterus to contract. It makes your uterine muscles to tighten and to relax, and these contractions could make you feel menstrual cramps. Also, the excess of prostaglandins can result in systemic symptoms such as nausea, vomiting, for example, bloating, headache. And primary dysmenorrhea usually starts in teens, soon after your first period. And there are some risk factors for primary dysmenorrhea, which include young age, smoking, higher body mass index, early age of menarche. Menarche is first menstruation in a girl's life, and different sources mention the different age of early menarche, but the most common is under 12 years old. Nulliparity, which means that you have never been pregnant, longer or heavy menstrual bleeding. Family history of dysmenorrhea. Different sources have different opinion on these risk factors. For example, some sources say that smoking affecting your dysmenorrhea, and some sources say that not. Anyway, I decided to mention all of these risk factors because maybe it would work for you. Secondary dysmenorrhea is a painful periods which are caused by another health conditions. For example, it might be caused by adenomyosis, endometriosis, by fibroids, and it's also often associated with another symptoms, for example, like dyspareunia, which is pain during sexual intercourse, or with menorrhagia, which is heavy menstrual bleeding, and bleeding between menstruations. It could be associated with another symptoms too. It will depend on what causing your secondary dysmenorrhea. And secondary dysmenorrhea can occur at any age. If you have dysmenorrhea, you need to go to the doctor and get a medical checkup. Your doctor will decide what methods are needed for you based on your medical history and on the results of your previous tests if you had one. The most common methods that are used for dysmenorrhea diagnosis are, of course, pelvic exam, ultrasound, sometimes MRI, CT, hysteroscopy, laparoscopy. Treatment of dysmenorrhea will depend on which type of dysmenorrhea do you have. And if you have secondary dysmenorrhea, you need to treat a health condition that causes you painful periods. And for primary dysmenorrhea, primary dysmenorrhea is lessens with age and after giving birth. Also, as you remember, there are some risk factors for primary dysmenorrhea, and you need to work on reducing these risk factors. Like you need to stop smoking and normalize your body mass index. Also, there is some research which is telling us that exercising 3 times a week from 45 to 60 minutes is improving your dysmenorrhea. The most common medications that are used for primary dysmenorrhea treatment is painkillers such as NSAIDs, and it's oral contraceptive pills. Sometimes intrauterine devices are recommended to people with primary dysmenorrhea. Of course, this treatment will depend on whether you're planning pregnancy or not, and whether you have some contraindications for these medications or not. Also, there are some devices that are used for pain relief, and you need to ask your doctor about it. People love to use heat to relieve menstrual pain, but I think that you should be careful with it, because you need to be sure that you don't have inflammatory diseases. And of course, you need to be sure that you won't burn your skin. There's opinion exists that vitamins and magnesium could be effective in dysmenorrhea treatment, but this opinion requires more studies, and maybe in the future vitamins and magnesium would be recommended as effective treatment for dysmenorrhea. I hope you find this video helpful, and I hope you learned something new. If you know someone who have dysmenorrhea, you could share this video with them. Thanks a lot for watching. Hope to see you in my next video. Bye!